Please, sir.
Thank you, Chairs. I'm going to talk to you about the wall femto laser creating a paradigm shift in the refractive correction, and which is evolving into one of the ideal laser vision correction. We have comparison of the LASIK is around 20 millimeter. You open the flap in the stroma, whereas the smile you open around say 2 to 3 millimeter, depending upon your experience. Relaxed smile is a third generation laser vision correction, which gives you a better ideal vision correction in terms of the visual acuity and the accuracy, in terms of contrast sensitivity, mainly the contrast sensitivity, higher order induction. Mainly the spherical aberration in excimer laser is more common, but that is not taking place. And the taking about the corneal, the dry eye, corneal strength, safety, above all, the patient comfort and the surgeon comfort during the surgery. What are the evidences to say this particular point? We have our own experience. We have with our femto single-step laser. We have about 90% of our patients are seeing 6.6 without correction for the quantity of vision. More than 99% are seeing 6.9. No loss of best corrected visual acuity. Even we have seen the results are very good in cylinders around 3.5 to 4 at this moment. So we are very happy. Now the cylindrical correction can be upgraded up to 5. So that's a good correction. See, the study also in our country, Mr. Gupta has done it. It's around say 96% of the eyes they have done 2020. 92% they see 40-50 LASIK group. So almost comparable in vision terms. So the gold standard of LASIK is comparable with the LASIK procedure in terms of acuity of vision. In terms of looking at the higher order aberration, the higher order aberration induction is not taking place in terms of the femtosecond laser ablation, the lenticular extraction. Whereas in case of excimer laser ablation, you do induce a spherical aberration, and if the patient is not cooperative, you do induce coma also. So that is not happening. You can see our picture, this pre-operative and post-operative. This picture is the pre-op and the post-op. Not much of change. Conclusion, the induction of higher order aberration after femto-LASIK and relaxed smile was not, the same study is also taking place in S K. So our study is incomparable to the European study. Looking at the contrast sensitivity of those patients, this preoperative picture and the postoperative picture, almost same, except a little bit dip there. Otherwise, the contrast sensitivity remains the same, it's not altered. The quality of vision, when the contrast sensitivity is better, the quality should be improving. Then studied by the Sukhunto and group, neither the mesopic and the photopic contrast sensitivity showed any significant changes. Relaxed smile produces satisfactory refractive outcomes. That is the conclusion. In terms of corneal strength, the tensile strength of the cornea, they have studied the flap-based LASIK and relaxed flex. And the flap-free relaxed smile result in similar reduction in corneal biomechanics when evaluated with Corbis ST and ORA. But this is one study. There are many other studies say the corneal strength is retained better with the smile. Dry eye definitely is better with this the smile because you are not cutting the corneal nerves as we do with the LASIK procedure. And there are a lot of study supporting our conclusion. Safety, definitely because no flap related. When you're using a LASIK procedure, the microkeratomy is also fixing on the eyeball, the pressure is around 30-40. It has a pressure on the goblet cells. That is one of the factors for inducing dry eye, in addition to your flap. In this case, and the safety is no flap displacement and everything is fine. The patient is recovers, though slow, but safety margin is very good. So a relaxed smile with a cylindrical correction up to 4.5, safe for glaucoma suspects also, because the intraocular pressure induced was minimum. It's not very high compared to LASIK. Enhancement, there are many procedures are available. So has all the properties for ideal laser vision correction, the future laser vision correction for glass-free vision. Thank you for listening.
Thank you. Thank you for finishing in time.